beginning the very first chapter of pathology with the word cell. And we are not talking about just any cell, but a normal cell. That is a cell that is under homeostasis. Now let's say this normal cell that is under homeostasis experiences some stress, and the cause of stress can be any injurious agent, be it heat, cold, lack of oxygen, electricity, trauma, whatever be the injurious agent. Now, in response to this stress by injurious agent, the cell shows adaptation, referred to as cellular adaptation. If the cell, however, fails to adapt to the stress, it fails to adapt, the cell gets injured. And the very first injury that the cell sustains is referred to as reversible cell injury. As the name says, this cell injury is reversible. That is, at this point, if the stress is removed, that is, if the cause of stress or the injurious agent is removed, then reversal of the condition of the cell takes place. That is, the cell returns back to its original normal condition. But if the stress is not removed, that is, the stress persists or continues, then eventually the cell suffers irreversible cell injury. And as the name says, at this point, even if the stress is removed, the cell has been injured so much that it will never return back to its normal condition. That is, now the condition is irreversible. Now, when irreversible cell injury progresses, eventually the cell dies, referred to as cell death. There are many ways a cell dies, but there are two major ways. They are necrosis, also referred to as cell murder, and apoptosis, also referred to as cell suicide. So that's it. Initially, we have a normal cell going through the process of homeostasis. This normal cell experiences some stress due to an injurious agent. This injurious agent can be heat, cold, lack of oxygen, electricity, trauma. In response to this stress, the normal cell adapts itself, referred to as cellular adaptation. If the adaptation fails, then the cell gets injured. The very first injury that the cell sustains is reversible cell injury. As the name says, the injury is reversible. That is, once the stress or the injurious agent is removed, the injury returns or injury recovers and the cell returns back to its normal condition. But if the stress persists or it continues, the cell gets injured irreversibly, referred to as irreversible cell injury. At this point, this is referred to as the point of no return. The reason being, at this point, even if you remove the stress, the cell has been injured so much so that it will not get reversed back to its original condition. It will not return back to its original normal condition. It has been injured permanently. There is permanent injury at this point. Eventually, the irreversible cell injury leads to the death of the cell, either by cell murder, referred to as necrosis, or cell suicide, referred to as apoptosis. However, there are other ways cell dies as well, like necroptosis, pyroptosis, ferroptosis. We will learn about them as well. Now, under the chapter of cell injury, we are going to learn about cellular adaptations, then reversible cell injury, then irreversible cell injury, then various ways of cell dies like necrosis and apoptosis and ferroptosis, pyroptosis, anoikis, whatever else. Starting the lecture with cellular adaptation. So what is cellular adaptation? Cellular adaptation refers to the various ways a cell adapts whenever it experiences stress due to an injurious agent. And remember, all cellular adaptations are reversible. See, till this point, till reversible in cell injury, everything is reversible. That is, till this point, if stress is removed, the cell returns back to its normal condition. During cellular adaptation, if stress is removed, the cell returns back to its normal condition. During reversible cell injury, if stress is removed, it will return back to its normal original condition. There are 4 major ways a cell adapts. Let's see what are they. So first, what we have here is a normal cell that is under homeostasis. Now this normal cell experiences stress due to an injurious agent. In response to this stress, it shows adaptation by 4 major ways. Number 1, hypertrophy. Hyper refers to increase, trophy refers to size. So there is increase in size of cell. Second, hyperplasia. Hyper refers to increase and plasia refers to number. So there is increase in number of cell. Third, atrophy. A refers to absence and trophy refers to growth. So there is absence of growth of cell or decrease in growth of cell. There is either decrease in size of cell or number of cell or both. And finally, metaplasia, where there is change in type of cell itself. So first is hypertrophy, where there is increase in the size of cell. Second is hyperplasia, where there is increase in the number of cell. Third is atrophy, where there is decrease in the size as well as number or one of them. And number 4, metaplasia, where there is change in the type of cell itself. Number 1, hypertrophy. Hyper refers to increase and trophy refers to size. So there is increase in size of cell. Mechanism of action. So the size of cell increases when there is increase in protein content within the cell. And there is increase in protein content within the cell when there is more mRNA to form that protein. There is more mRNA to form that protein when more DNA goes through the process of transcription. That means there is increased transcription taking place. More transcription takes place when there is more transcription factors. So this is the mechanism of action. There is increase in transcription factor. As a result, there is increase in the process of transcription, giving us more mRNA that ends up forming more protein. And this more protein forms more mass of the cell, resulting in increase in size of the cell. Hypertrophy is of 2 types. In fact, all cellular adaptations, they are broadly categorized as 2. Physiologic cellular adaptation and pathologic cellular adaptation. Physiologic refers to normal condition of the body. Pathologic refers to abnormal or diseased condition of the body. So cellular adaptation in a physiologic condition refers to adaptation of the cell in a normal body functioning state, while pathological cellular adaptation refers to adaptation of cell in an abnormal diseased state of the body. Okay, physiologic is normal condition, pathologic is diseased condition. So if adaptation of the cell can take place in normal and diseased condition, that means all the types of cellular adaptations are also of 2 types. You have physiologic hypertrophy, pathologic hypertrophy, physiologic hyperplasia, pathologic hyperplasia, physiologic atrophy, pathologic atrophy. Starting off with physiologic hypertrophy, that is increase in size of cell as an adaptation feature in a normal physiologic condition. Number 1, gravity uterus. Here how increase in size takes place. See, during a pregnancy, the size of the uterus, it increases in order to accommodate for the growing child. So in a pregnant condition, in order to accommodate the growing child, the size of the womb, the size of the uterus increases. We know this much. For the size of the uterus to increase, the individual cell making of the uterus also increases in size. So there is hypertrophy of the cell of the uterus. Second, skeletal muscle after pumping iron. See, there are certain cells in the body like neuron, skeletal muscle cell, and cardiac muscle cell that are unable to divide but can grow in size. So skeletal muscles like your bicep, once you go in the gym, work them out using weight, overload, progressive overload, they grow in size. The growth of the size of the muscle takes place due to growth in size of the individual muscle fiber, individual skeletal muscle fiber. So there is skeletal muscle hypertrophy, increase in size of the skeletal muscle fiber once you train that particular muscle. Third, compensatory hypertrophy. When one kidney is surgically removed, there is loss of function of that one kidney in that body. In order to compensate for the loss in function due to removal of one kidney, the other kidney grows larger in size. It becomes larger in size. The nephron inside the kidney, they become larger in size also. Why? In order to compensate for the loss of function due to the removal of the other kidney. This is compensatory hypertrophy during nephrectomy. That is removal of one kidney. Nephrectomy, removal of a kidney. Next, breast in puberty and pregnancy. During puberty and pregnancy, due to the action of estrogen and progesterone, the size of the breast increases due to increase in size of the cells making of the breast. Pathologic hypertrophy. So hypertrophy of the smooth muscle proximal to obstruction. For example, let's say there is a tube in the body. Through this tube, certain content passes, whatever be the content. The wall of the tube contains smooth muscle. It is due to the contraction of this smooth muscle that the content inside the tube gets pushed downward. But let's say at this point, obstruction takes place. As a result, the content is unable to pass through the obstruction. There's the tube, there's the content within the tube, and there's the obstruction. The content is unable to pass through the obstruction. As a result, what happens? The part of the tube proximal to the obstruction, now has to contract harder. It has to work harder in order to push the same content downward. So as an adaptation, the smooth muscle in the wall of the tube proximal to the obstruction grows thicker and larger so that it can contract harder and push the same content downward. So this is an adaptation taking place in the wall of the smooth muscle lining the wall proximal to the obstruction. Let's look at similar conditions. First, this is achalasia cardia. In achalasia cardia, the obstruction takes place at the level of lower esophageal sphincter. The lower esophageal sphincter remains closed. As a result, food within the esophagus does not enter the stomach. So what? So the esophagus proximal to the lower esophageal sphincter has to work harder. The smooth muscle inside has to contract harder in order to push the same food into the stomach. So as an adaptation, the smooth muscle grows larger and thicker. So smooth muscle hypertrophy takes place. Second is the condition of pyloric stenosis. Here, stenosis or narrowing or obstruction is taking place at the level of pyloric sphincter. pyloric sphincter. As a result, the part of the stomach proximal to the pyloric sphincter, that is the pyloric antrum, has to work harder, has to contract harder. So there is hypertrophy of the smooth muscle in the wall of the stomach. Third is urethral stenosis. Due to narrowing of the urethra, it is difficult to pass the urine out of the urinary bladder. So the urinary bladder has to contract or squeeze harder, or the detrusor muscle within the urinary bladder has to contract harder to push the same urine out of the urethra. So the muscle goes through the process of hypertrophy and it grows thicker. There is hypertrophy of the smooth muscle lining the wall of the urinary bladder so that it can contract with more force and push out the urine through that obstruction. Okay. Second is hypertension. There's two types of hypertension, systemic hypertension and pulmonary hypertension. In systemic hypertension, there is increase in blood pressure within the systemic artery. As a result, your left ventricle has to contract harder in order to push against that increased resistance in the systemic artery, leading to left ventricular hypertrophy. In pulmonary hypertension, there is increase in blood pressure within the pulmonary artery. So it is your right ventricle that has to pump, push, squeeze harder in order to push the blood into the pulmonary artery against the increased resistance. So there is right ventricular hypertrophy. So in systemic hypertension, left ventricular hypertrophy. In pulmonary hypertension, right ventricular hypertrophy. Next, hyperplasia, where there is increase in number of cells. Mechanism of action, increased mitosis. Physiologic hyperplasia. First, gravid uterus. So during pregnancy, the size of the uterus increases in order to accommodate the growing fetus, growing baby. During the increase in size of the uterus, it does not just go through hypertrophy, it also goes through hyperplasia. So there is both increase in size of the cell as well as increase in number of the cell of the uterus. Second, breast during puberty and pregnancy. So during puberty and pregnancy, due to the activity of estrogen and progesterone, the size of the breast increases, both due to increase in the size of the cells making up, the size of the breast increases, both due to increase in size of the cell making of the breast as well as increase in number of the cell making of the breast. So there is both hypertrophy as well as hyperplasia of the breast taking place in puberty and pregnancy. Third, compensatory hyperplasia. So after nephrectomy, as I explained earlier, when one kidney is removed, in order to compensate for the loss in function of that kidney, the other kidney grows larger in size. Here, not just increase in size of the nephron takes place, but also increase in number of nephron takes place. So there is both hypertrophy and hyperplasia. Pathological. First is endometrial hyperplasia. When there is increased unopposed action of estrogen, the endometrium lining the inner wall of the inner wall of the uterus, it proliferates and grows larger in size. This is endometrial hyperplasia. Second is benign prostatic hyperplasia. Due to increase in age, there is also increase in dihydrotestosterone. This dihydrotestosterone goes and acts in the cell of the prostate gland, increasing the number of cells making up the prostate gland, leading to prostate hyperplasia. Hyperplasia, pathological hyperplasia, can be precancerous. For example, endometrial hyperplasia is precancerous. It can lead to endometrial cancer. However, benign prostatic hyperplasia, it contains the word benign, so it is not precancerous. It never ends up forming a cancer. Atrophy. A means absence. Trophy means growth. So there is absence or decrease in growth of the cell. Either there is decrease in size or number or both of the cell. Mechanism of action is ubiquitin proteasome pathway. Just remember the name, ubiquitin proteasome pathway. First, physiologic atrophy. Thymus atrophy. In adult, the thymus gland that is present at your neck area, it degenerates eventually. And it grows, first it grows smaller in size and eventually it degenerates. That is thymus atrophy. Second is ovarian atrophy. After menopause, due to absence of estrogen, the ovary, it degenerates or it goes through atrophy. Third, uterus. After, let's just write uterus, uterine atrophy. Uterine atrophy. This is after delivery. So during pregnancy, the size of the uterus increases in order to accommodate the growing baby. There is both hypertrophy and hyperplasia of the uterus. But after the delivery of the baby, the uterus comes back to its normal size by the process of atrophy. There is decrease in the size of the cell as well as decrease in the number of the cell. Pathological atrophy. We have 5 major pathological atrophies. First is diffuse atrophy. Let's take an example. Let's say a person goes through a ligament tear in the knee. Let's say ACL tear. As a result, he is unable to walk for one whole month. That means the muscles in his leg, the muscles in his thigh is not being used for 4 whole months. Thigh muscles not used for one whole month, and it grows smaller in size. So this is disuse atrophy. When you don't use a certain muscle in your body, over a period of time, it grows smaller in size. Like in this case, since the knee is injured, the patient is unable to walk. He has to take complete bed rest for 1 month. So he's not using his leg muscle at all. The leg muscle of the leg that has gone through the knee injury, he's not using the leg muscle at all. So that muscle eventually grows smaller in size because it is not being used. Second is denervation atrophy. So there's a skeletal muscle. Skeletal muscle, it is supplied by motor neuron. So there is a motor supply. Let's say this motor supply due to some reason gets destroyed, which is referred to as denervation of the muscle. That is, the nerve supply to the muscle has been destroyed. Denervation of skeletal muscle takes place. As a result, what? The person is unable to use the skeletal muscle and it grows smaller in size. For example, in case of polio, the nerve supply to your leg gets destroyed. As a result, the patient is unable to use the muscle of his leg and there is decrease in size of the muscle of the leg. Third is malnutrition atrophy. When there is malnutrition, lack of nutrition, the body breaks down muscle for energy, and eventually all the muscle gets wasted. There is muscle wasting and the person becomes smaller in size. The muscle becomes smaller in size, even the person becomes smaller in size, because the muscle from throughout the body has been wasted, has been used to produce whatever energy possible. Ischemic atrophy. In old age, there is reduced blood supply to brain, which is referred to as ischemia, due to which brain goes through atrophy. There is a reduced size of the brain, reduced size in the parenchyma of the brain. So there is loss of memory, also referred to as Alzheimer's. That is why old people suffer from Alzheimer. Endometrial atrophy. Due to reduced estrogen level, the endometrium goes through atrophy. When there is too much estrogen, there is endometrial hyperplasia, which turns into cancer. When there is too less estrogen, the endometrial goes through atrophy, which can also turn into cancer. Metaplasia. In metaplasia, change in type of cell takes place. Mechanism of action. See, cells, all the cells in the body, they arise from a precursor stem cell. For example, there are squamous cells in your body. Squamous cells lining your buccal cavity. There's squamous cell lining your buccal cavity. These squamous cells, they come from a basal cell, which is the stem cell giving rise to this squamous cell. The stem cell has its own intrinsic program written. That is, it is programmed to form that particular type of cell. Let's say the stem cell forming squamous cell has been programmed to form squamous cell. But let's say somehow this program gets damaged and new program is overwritten. There is new program overwritten over the old program. New program tells this stem cell to produce columnar cells now. What happens? Instead of forming squamous cell, the stem cell now starts forming columnar cell. And the squamous cells, they get replaced by columnar cell. So there is complete replacement of one type of cell by other type of cell. There is eventually change in the type of cell taking place itself, and this is metaplasia. So eventually the mechanism of action is stem cell reprogramming. The previous program gets overwritten. Okay. Now, metaplasia can take place within epithelial cell. That is, one type of epithelial cell is converted to another type of epithelial cell, or mesenchymal cell. That is, one type of mesenchymal cell is converted into another type of mesenchymal cell. First, epithelial. Your trachea and bronchi is lined by respiratory epithelium, which is none other than pseudostratified ciliated columnar epithelium. In chronic smoker, this respiratory epithelium gets replaced by squamous epithelium. So one type of epithelium, the columnar epithelium, has been replaced by another type of epithelium, that is squamous epithelium. Is this metaplasia? Yes. What is the type? What is the metaplasia called? The name is given as per the resulting epithelium. So the name is given as per the resulting epithelium. So this is squamous metaplasia. Second. So the esophagus is lined by non-keratinized stratified squamous epithelium. In case of chronic gastroesophageal reflux disease, the HCl from within the stomach regurgitates back into the lower part of the esophagus. Now, as an adaptation, the squamous cell gets replaced by intestinal type of columnar cell. Why? Because the intestinal columnar cells, they contain goblet cells. And these goblet cells, they produce mucin. And mucin protects the wall of the esophagus from the harmful activity of the HCl. So there is intestinal columnar epithelium. The metaplasia is referred to as intestinal or columnar metaplasia. The part of the esophagus right here where the metaplasia has taken place is referred to as Barrett's esophagus. Third condition, the lactiferous duct is lined by cuboidal epithelium. But in case of chronic smoker women, it is replaced by squamous epithelium. So there is squamous metaplasia of lactiferous duct, also referred to as SMOLD. Okay. Next, mesenchymal tissue to mesenchymal tissue. We have muscle here, which is a mesenchymal tissue. Let's say this muscle at this point goes through trauma. During the process of healing, the muscle gets replaced by bone, which is also another mesenchymal tissue. So is this metaplasia? Yes, this is metaplasia. In this condition is referred to as myositis ossificans. Pretty easy. Myo refers to muscle. Itis refers to inflammation. Since there is injury, obviously it is accompanied by inflammation. Ossificans refers to ossification, that is formation of bone. Formation of bone is taking place. Look at this X-ray. There is muscle tissue here. There is muscle tissue here. At this point, trauma took place. Due to trauma, the injured part of the muscle got replaced by bone. So there's bone growth in muscle tissue. This is myositis ossificans. Few special points. Number 1. During pregnancy, the size of the uterus increases. There is both hypertrophy and hyperplasia taking place. But most importantly, hypertrophy is taking place. During puberty and pregnancy, the size of the breast increases. There is both hypertrophy and hyperplasia taking place. But more important is hyperplasia. During nephrectomy, after nephrectomy, as compensation, both hypertrophy and hyperplasia of the other kidney takes place. Another. Endometrium. When there is increased and unopposed activity of estrogen, endometrium goes through hyperplasia. And this can eventually lead to endometrial cancer type 1. When there is decreased estrogen, however, this leads to atrophy of the endometrium, which can also result into endometrial cancer type 2, where the cancer due to atrophy is more dangerous or has worse prognosis.